we know that kaya kan home na bihis mo kay si Hanin mo mani biya magay nasta haji mo. Good morning, people. I was asked to translate what I said earlier in English because we have a lot of community members that don't speak Innu for different reasons. First of all, I'd like to thank everyone that's listening to the radio this morning, and I know it's very important for everyone to hear what's on the go, and I'm sure everyone is hearing it on the TV, radio. It's all over the world what we're going through here in this town. It's not only we're trying to keep our community safe, and when we get updates from the government officials and our nurses gets calls, and then we get the call, so we need to update the community just to let them know where we're at. So we're just trying to let the community members know about the importance of being home and self-distancing each other, and not to be going everywhere like a random day, like a regular day. We need to do cutback on travels, how many times we go to Goose Bay a day, limited ourselves per vehicle. No children should be going to Goose Bay unless they have to go to emergency, or if it's emergency. Other than that, we're asking for families to leave their children home with other families, so that way the process is a little bit easier, because we need to keep track of how many people is going in and out of the community. It's important to know that, because that's the important calls that we're getting from the officials, government officials, and the nurses and doctors. We just need to keep our town safe. But Monday we'll be having security at the main entrance there up on the hill, and one towards on the RCMP station. We'll be having security there. They'll be doing monitoring the traffic going in and out. But people still allowed to go to co-op, drugstore, emergency, only if needed. Other than that, if you don't have to go any reason to go out, everybody should be staying home. And it's important for everybody to listen what do we have to say here, because it's very important. Because as you all know, this virus doesn't have a cure. That's the important part everybody needs to know, because we're trying to monitor, stop this from coming in our community, because we do have a lot of illness people in our community that's on dialysis, diabetes, asthma, and that's very important for our community members to know. If you don't have a reason to leave Sheshatshiu or come in Sheshatshiu, just everybody should be staying home. I think that's the important part that we need to get out, and family members to be helping each other out. You can still call your family members or elders just to see if they need anything, just to update them and what you're hearing as well. The whole point of this is because we are a big community, 2,000, and we have a lot of people living in one home. Some of them is probably 12 in one home, and I think that's the important part of why we keep doing this, is because we don't want to bring the infection into our homes and put everybody at risk. So that's what we got to worry about with our families and elders. And also, it's important to know is everybody just to follow what we're saying to people in Sheshatshiu. And this is not only us that's doing this procedure, it's everywhere, all over the world. And it's important to know what we're planning, what our plans are, because Monday I'll give another update Monday, because a few people are gone up on the road to their cabins, and or on the road in their tents, which is good. No one's being stopped from going anywhere to isolate themselves with their families. And we'll know more about outposts Monday, because we're waiting on the government officials to send us a letter just in case emergency happens in the country, while an outbreak happens or something, that we need to go get them. We need to be prepared, because we don't want to send people in anywhere that help can't come their way. We need to be cautious, and I'm glad the community is being patient with us as well, because we don't want to jump to something and not jump to something that we can't help out with anybody. I think that's the important part of every procedure that's in place. And everyone should be cautioned, like social distancing. I think that's very important. If we all can follow what we're asked to do, I think we would be good. Like if we're asked, there's a few people that sometimes that don't take this serious, and it's time to think about it twice, because it is serious issue for our town, because we have family and community members. As we know, like population of 2,000 in Sheshatshiu is a nice big number, but we still got to prevent ourselves as well. So we're going to have security set up Monday on each side of the roads. Just remind that again, and there will be security there. And it's going to be as the week goes by, it's going to be limited only for grocery stores, emergency, and drugstore. That's going to be an important part. So people that work in Sheshatshiu are still allowed to come in, like the DMAC store or SIFN store or LGH. They're still there. There's on-call staff there at LGH. But I think we still need to be cautious, but you never know, that could change in the upcoming week. We don't know yet until we get more news. Every day is a different day. Every day we get different news. And so I'd just like to pressure that out there, is be cautious if you're in and out of the community, because we shouldn't be going anywhere basically where we don't need to go. I think that's the important part, is stay home. If you don't need to go anywhere, stay home. We don't have time to be, it's not for joyriding or whatever. If you don't need to go anywhere, just stay home. And I don't know how many times I want to be saying that all week, but I will be saying it to everybody. It's not only everybody, me too, and the staff too are being cautious, because we don't want our staff to get sick as well. And because we're trying our hardest as well to bring the services to the community, and everyone doing up their own plans, because you got to be prepared for this, because there's a big preparation, because we don't know. You got to think ahead a little bit. So I'd like to thank the staff, the council that's been helping us out all week, and the directors for having their input and their say in what we're doing in the community. And I think it's very important the community know that we're on top of this as well. And when I was talking to Health Labrador, I called a lady this morning. She said that I think we're the first ones that were preparing for this virus. And I think that's very important for everybody to know, like, it's being looked at serious. And nothing here is a joking matter, because it's people's lives we're talking about. But sometimes you got to sound like that in order for people to get the message. But I'd like to thank everybody, and be safe and have a good day. Thank you.